First of all, I would like to give you an update on the latest epidemic situation in Hebei province. On January the 14th from 0 to 10 o'clock, Hebei reported 47 new local confirmed cases, all in Shijiazhuang City, 43 in Gaocheng District, 2 in Lihua District, 1 in Kaohsiung District, 1 in Chang'an District. From 0 to 10 o'clock, no new asymptomatic cases on January the 14th. Start from January the 2nd to 10 o'clock of January the 14th, Hebei has cumulative reports of 524 local confirmed cases, 494 in Shijiazhuang City, 28 in Xintai City, 1 in Langfang City. Start from January the 2nd to 10 o'clock of January the 14th. Hebei has cumulative reports of 320 asymptomatic cases, 308 in Shijiazhuang, 12 in Xintai. Yesterday, Shijiazhuang reported 1 new death. 12 confirmed cases were cured and discharged from hospital, according to the 8th edition of the diagnosis plan, and they will go to number 5 hospital of Shijiazhuang for isolation and quarantine, and their health condition will continue to be monitored. And right now, 15 asymptomatic cases are removed from the quarantine. Now I would like to give you an update on our key work, especially for the nucleic acid testing in the past 2 days. And also I will give you an update on the progress on the epidemic fight in Hebei province. Previously, we scheduled after we complete the first round of NAT, after 7 days we will roll out the second round of mass testing. With the analysis of the experts in order to identify potential patients as soon as possible, start from January the 12th, we have started the second round of nucleic acid testing to Shijiazhuang, Dingzhou, Xinji, and Xintai. On January the 11th, we found 1 case in Gu'an County of Langfang. On January the 12th, we started a mass testing in Langfang City. With joint efforts, as of now, Langfang, Dingzhou, Xinji all completed the nucleic acid testing. All people are tested negative. Shijiazhuang, Xintai will complete the second round testing by the end of today. Based on the current situation, for all the patients that are being rescued and also the asymptomatic cases, most of them have been identified from the mass testing, especially for people from Zhengchun village of Gaocheng District. For this village, it has rolled out 4 rounds of nucleic acid testing. For the Nangong region of Xintai City, they also completed 2 rounds of nucleic acid testing. We have identified positive cases by no time. This will help us to save some time for the treatment, and also this will help the spread, to contain the spread of the virus. This means nucleic acid testing is very important for us to exercise the 4 early measures. This large-scale nucleic acid testing can be completed within 3 days. This is a very hard work. In order to improve the efficiency and ensure the quality of the testing, we carefully analyze the situation for the first round of nucleic acid testing And for the second round of testing, we have taken the following targeted measures. First, our objective is to serve the majority of the people and also attend to the needs of the minority group of people. We are also analyzing the composition of population. We set up reasonable sampling sites. For hundreds of public transportation buses have sent to Shijiazhuang. They will be used as the mobile sampling place. This will improve the environment for the medics and also bring convenience to the general public. To the elderly group or people who are not able to move, so we will go to their house and collect samples. Second, we will focus on the majority of our people, and also we are rolling out an appointment system. The medics will go to each household and publish notification. We also have volunteers to provide guidance so that the testing can be done by buildings, by compounds. This can make sure that we have accurate and scientific sampling procedures. Third, focus on the number of residents. We will provide sufficient manpower. We will put them into different groups. For different sampling sites, we have professional sample takers and also people to register information, and also some people are responsible to maintain the order of the sampling, making sure that there's no gathering and long queue for the sampling. Fourth, we also use information technology. We are collecting the samples, we're transferring these samples to the laboratories, and also we are publish all the information online. By doing all of that, we can improve the accuracy of the sampling and also improve the testing qualities. This is actually a seamless procedures and contactless procedures. People can track down each procedures using their mobile phones. At the same time, we are giving enough protection for people so that we can reduce the risk of cross-infection. Mass testing is actually concerning the health of every one of our residents. It has a very large hard work, and also we have very tight schedule. It also poses a big challenge for all of us. In this procedure, the medical workers, they have to deal with tens of thousands of samples. They're working really hard, and also they're taking the samples carefully, register the patient's information, and they're following a very standard procedures to ensure the quality of the testing. The CPC members and community workers, they bear the responsibilities and do what they can to mobilize the residents and encourage them to receive the nucleic acid testing. This will also ensure the efficiency and the operation of the testing work. We're using our real hard work and efforts to show that we have put our people's life and safety at the top priority. So I would like to pay tribute and heartfelt thanks to all of them. Right now, Hebei province, in particular in Shijiazhuang city, the epidemic situation is very severe. We have very big pressure ahead of us. The provincial government has emphasized that we have to mobilize efforts from all sectors of our province to win this battle against COVID. And right now, we have some cities that do not have any reported cases. They strengthen their measures in prevention and control and respond to the epidemic. So first, to the people who have been visited the mid and high-risk regions, they are screening out their health condition. They are rolling out nucleic acid testing to these people. When necessary, these people will be brought to quarantine and isolation. And also, we are focusing on the prevention and control work in the villages and communities. We're also focusing on the safety of the cold chain logistics. Also focusing on some public facilities. For example, we will do some disinfection to those places. We are clarifying and specifying the green style management, making sure that we can register personal informations and do disinfections, and also have a good traffic control, making sure that no place is left unchecked. And second, we will also draw on our experiences on handling the prevention and control in Shijiazhuang. Also, we are doing what we can to supply sufficient medical resources to treat the patients. For example, we will mobilize the talents to help with the treatment and also arrange the isolation and quarantine sites, making sure we have sufficient supplies and manpower to cope with the epidemic. Third, in terms of the manpower and ambulance, we will mobilize all the available resources to the fight with Shijiazhuang, Xingtai, and Langfang. For Handan, Baoding, Cangzhou, Lenshui, Dingzhou, Xinji, 6 cities are very close to Shijiazhuang, and these places are getting ready to support Shijiazhuang and Xingtai when necessary. Thank you. Thank you. First, I would like to give the floor to Chen Ping to give us an update on the appointment of a certain member for the CPC member. This is actually a notification to appoint Li Ruizhi as CPC member. This notification is published on January the 13th. Li Ruizhi, female, Han ethnic group from Hebei, Ningjing, and she was born in 1965, and she started to join the work in 1982. She used to be a worker in Shijiazhuang City. She retired in 2015, and she was elected as a community worker in 2018. She was elected as a member of the community center. And during fight against COVID-19, she's developed symptoms of this acute disease, and unfortunately, she lost her life during the fight against COVID-19. She is a very diligent worker and also worked very hard to serve the residents. She's always proactive and very responsible for the life of the local residents. And she is also passionate about her life. She always loved to help others and always help her colleagues. She actively participates in activities in the communities and also make a lot of donations to children in villages. She was beloved and praised by the local communities and the villages. And she's also a model in the community. In the 2021, during her fight in COVID-19, she was responsible for liaison with the local residents and registered personal information of the local residents. Because this time, we have a very daunting task and we have a shortage of the personnel. In order to complete the 3-day mass testing, Li Ruizhi came to the testing site and provided services to the local residents. She worked really hard from January the 6th to 7th, and she facilitated with her colleagues for the sampling. In the evening of the 7th, she passed out. On 8 o'clock, she started to have a heart attack. and lost her life, unfortunately. Comrade Li Ruizhi used to hand an application to join the CPC. She had always performed her duties and abide by the strictest standards during the fight against COVID-19. She came out and led the others. She dare not lose her life, and she actually set a model for the other people in the fight against COVID-19. She is actually a demonstration for the good work done by the local communities. In order to praise her hard work and also to pass down the spirit of CPC and encourage the general public to the fight against COVID-19, according to the chapter of the Communist Party of China and according to the detailed arrangement and regulations of CPC, with discussion with the CPC committee of the local community, we have approved Li Ruizhi's application, and she is one of the members of CPC. The provincial government would like to make appeal to the general public. We should all learn from Ms. Li Ruizhi to stay true to the original aspiration, live up to the mission, and make contribution to the society. Because she is loyal to the CPC and also she always bears the mind to serve the general public. She always not afraid of the epidemic and always dedicated in her post. Right now, we are still under the fight against COVID-19. All the different party committees have to follow the guidance from General Secretary Xi Jinping to stay united and take scientific approach to the fight against COVID-19. We have to lead the other comrades, especially for those key leaders. They have to hold on to their post, provide instructions and guidance to protect our territory, bear the responsibility, and discharge our duties in due course. So we have to be the front runners in this fight against COVID-19. We need to be the warrior in this fight. And for the CPC members, we have to build a strong defensive line and be a role model, making sure that the party flag can fly high at the front lines of COVID-19. We have to give full play to the role of CPC, and we have to unite our general public, making sure that the interest of our people is the top priority. We have to stay true to our original aspiration. We have to stand side by side with our general public and to implement the decisions from CPC Central Committee and be determined to win this battle against COVID-19 and to safeguard the stability of the society and ensure people's health and safety. Thank you. That is the notification. Thank you, Mr. Chen. Now is the Q&A session. Please raise your hand to raise your question. Please identify yourself before you raise your question. With Xinhua News Agency. So today we saw some of the patients were cured and discharged from the hospital. I would like to understand what are the treatment measures to those patients. For those discharged patients, shall we follow up with their situation? And also you're talking about we have one death reported in Shijiazhuang. Can you tell us more about this situation? Thank you. I would like to invite Mr. Yan to take your question.
大家知道，我们这一次突发的疫情，后来发现的病例，多数
As we all know, this time with the outbreak of the COVID-19 in Hebei, and most of the people were identified from the mass testing, and we also screen out the close contacts and the secondary contacts. And for most of the patients, they have very mild cases. And today we have 12 patients cured and discharged from the hospital. And these people were identified at a very early stage, and they have very mild symptoms. And maybe they have some non-disease, but in general, their situation is very stable, and we do not have very complicated way for the treatment. However, after these people being discharged, we have to follow the national standards, or what we call the ACE diagnosis plan. After the consultation of the experts, and these people have to meet the standards for the discharge, meaning that most of their clinical symptoms have disappeared, and also their lung situation have been improved. At least they have been tested negative for the nucleic acid testing for at least 2 times. And of course, these people have to stay in isolation for 14 days for further observation. And as these people have very mild symptoms, so it is not difficult to treat them, but still we are providing personalized treatment to these people. As for the death case you just mentioned, actually she is suffering with a very acute disease, and she is from Gaocheng district, and also a villager from Zhengchun district. So this patient is coming from a high-risk region. On January the 9th, she was tested positive, and she started to develop symptoms such as coughing and fever, and we transferred her to the Chest Hospital for treatment. But the main issue for this patient is that her situation deteriorated very fast. On the day she was admitted, we found she suffered from respiratory failure, and also she's not very well in the blood circulation, and also she was suffering from a septic shock. Except, on top of that, this patient also have some cardiovascular disease, and this will also cause some damage to her lung and also her heart. And also, she also suffered from liver damage. So all in all, her situation is not very stable during the treatment. We are using medicine to treat this patient, and also we are using incubation, and also we are using ECMO to save this patient. And actually, we are doing what we can. We are using the most advanced technology to save this patient. But still, as I said, this patient has a number of underlying disease, and her situation deteriorated very fast in just a few days. Even though we have a national experts and the provincial experts to provide consultation to this patient, and also we have some online consultation for this patient, but unfortunately, we are not able to save her, and she left us on January the 13th. Yes, she is a very critical patient, and also she suffered from the cardiovascular disease, so that's why she was not able to survive from this COVID. That is my answer. All right, next question. With Hebei Daily. So you just talked about we have decided to approve Li Rui's application, and she will be a member of CPC. So I would like to understand how we better leverage the role of CPC and also the CPC members. So I would like to give the floor to Mr. Chen Ping. So first of all, thank you for your questions. So for Comrade Li Ruizhi, so actually he is a very good example for one of the CPC members who have been fighting at the front line for COVID-19. I believe today, in the press conference, many of you are CPC members. Right now, this epidemic situation is still very severe. So comrades, you have been working very hard and also you are coming to the front line to do the coverage. And actually, you are playing a leading role and making a lot of contribution in the fight against COVID-19. By taking this opportunity, I would like to say a big thank you to all of you. For Hebei province, we have over 200,000 party organizations and over 22,000 members, CPC members in Shijiazhuang, Xingtai, and Langfang. We have 48,000 party organizations and over 1.2 million CPC members. During the fight against COVID-19, the provincial government has decided that we have to further build our party organizations and bring benefits to the local communities. We have rolled out a series of campaigns to emphasize the role of the Communist Party of China. And also we are encouraging the party members should play their role and lead others to fight against at the front line. They're always staying at the front line. Since the outbreak of COVID-19 in Hebei province, they immediately raced to Shijiazhuang, Xingtai, and Langfang and make their contribution in the fight. So for the local party organizations, they have played a key role. On one hand, for the districts and the communities, they earnestly implement their responsibilities by jurisdiction. They're using the grid-style management, screen out the key population, and also manage the population group, making sure that there's no gathering. And also they are building a very strong defensive line in the villages. In Shijiazhuang City, on January the 6th, all the communities in the villages have exercised lockdown management under the leadership of the local party organization. Over 1,500 real estate companies have exercised their duties and to protect the safety for these communities. For Nangong City, they also set up over 530 party organizations, and they're sending the party officials to go to the villages and go to the communities to provide service to the local residents. And for the Guan County of Langfang City, after we found the first confirmed case, they are doing a grid-style management, and within 24 hours, they have completed the nucleic acid testing to over 500,000 residents. And this is done just within 24 hours. And also for the other institutions and the party organizations, and especially for the medical institutions, they have played a key role and lead the medical workers. They have stayed committed and always stay at the front line of COVID-19. For the Commerce Department, Education Department, and Information and Technology sectors, and these places also set up a party organizations to manage the population flow, and also doing what they can to provide the daily necessities to the local residents. And also we have party organizations from the scientific organizations. They're accelerating their speed for the research and development of the drugs. And they're doing what they can to reserve the medicines, the drugs, and they provide daily service to the local residents. For the Chest Hospital is one of the designated hospital in Shijiazhuang to treat the COVID-19. And also they have set up over 10 party organizations. They also have some people appointed as the leader of the party organization. For Gaocheng District, from January the 3rd, they actually exercise lockdown to Xiaoguozhuang village. And also they're also setting up checking points at different places. And also we are sending over 1,000 police officers to facilitate with the prevention and control work. At the critical time to fight the COVID-19, the party organization have demonstrated their advantage and they give full play to the leadership. At the same time, the party members also playing key role and leading role. They are wearing the party emblem and also demonstrate their positions. They are also organizing the volunteers team. They are actively participating in the nucleic acid testing, and also they are working together to form an interagency task force. And these people have always standing at the front line and be the front runner and race with the time and fight with the epidemic. And also we see a great number of touching stories during this process. And right now in Shijiazhuang, Xingtai, Langfang, we have over 500,000 party members who are staying at the front line to fight against COVID-19. We also have some party members who are working in the local communities, and this group of people amounts to over 70,000 people. As for the medical workers, over 1/3 of them are members of CPC. We also have some people who used to participate in the fight against COVID-19 in Hubei province last year. And we also receive a lot of CPC applications from Xingtai and Langfang. And in January this year, one of the party member, she volunteered herself to fight against COVID-19 in Hebei, and she worked over 40 hours. And she always said she feel very proud to be at the front line to fight against COVID-19. And also another example is teacher Zhao Chunhua. Within 2 days, she collected donation with over 50,000 yuan. And also she's trying to provide daily necessities to the communities. And in Gaocheng District, we also have a 70-year-old CPC member. We all know in the past few days the temperature is very low, and she's still decided to stay in her post to help with the prevention and control work in the Gaocheng District. And for some young CPC members, they are working in the local communities. They are trying to deliver medicines, vegetables, waters to the elderly people who are staying on their own. So for the party members, they're actually providing a lot of services to the local residents. They're showing care to the local residents. Since the outbreak of COVID-19, the grassroots party members, they always stay at the front line. And for some people, they're working really hard, even overloaded, and some of them even lost their lives during the fight. After Li Ruizhi lost her life, And immediately, the provincial government have made the notification. We have to show care to Li Ruizhi's family member, and also we need to approve Li Ruizhi's application and make her become one of the members of CPC. And all of the CPC members should learn from Li Ruizhi. And we have to strengthen our care to the frontline medical workers with the arrangement of the provincial government. The organization department have already allocated 1.6 million yuan as the funding to support the prevention and control work in Shijiazhuang and Xingtai. And all of these funds will provide support to the CPC members who have been fought on the front line. And we will also provide subsidies to CPC members who fall back to poverty because of the epidemic. The provincial government also emphasized that we have to ensure the safety for the frontline medical workers. We have to have a very flexible schedule to make sure that they could have sufficient rest and to solve the difficulties they have faced during the fight. So going forward, we have to continue to give full play to the role of the CPC and also approve applications for some of the key leaders in the fight against COVID-19. For some people who have made extraordinary contribution during the fight against COVID-19, we will give award when necessary. And at the same time, we will find some people, if they're not conducting their work, we will move their position as a member of CPC. So by doing all of that, we can give full play to the role of CPC and making sure that the party flag can fly high at the front line of COVID-19. Thank you. Thank you, Mr. Chen, Ping's introduction. And we have one last question. With CGTN. Right now, do we understand for some of the students they're not able to go back to hometown because of the epidemic. And right now, we may have some people staying in Shijiazhuang City. So I would like to understand the arrangement from the educational department. So I would like to invite Ms. Han Aili to answer your question. Thank you for your question. We attach great importance to the situation of students who are staying in Hebei province. We will take a series of measures to provide assistance to those students who are staying in Hebei province. And last week, Hebei province, the educational department have a general understanding of the situation right now. After the vacation, and we found 2,127 students staying in Shijiazhuang. Because these students, they are staying in Shijiazhuang to prepare for examinations, and they're not able to catch up the last chain to go back to their hometown. And these people, they're staying in desolated hotels and also staying in the households of some of their classmates. So we are asking the campus to provide support to the students. They have to reach out to those students to understand their situation. And also we need to collect their information. We have to remind them to protect themselves. And at the same time, we need to provide assistance to those students who are staying in Shijiazhuang when necessary. So right now, we have an instructed program, making sure that the instructors can reach out to a number of students. We have taken the following measures. First, we will step up efforts for the assistance. For some of the students, if they are in difficulties, we will provide some temporary subsidies to ensure their daily life. And for some of the campus, they are sending out disinfectants and facial masks. And the second, we will provide some humanitarian care to these students. And for the instructors, they will have a conversation every day to the students and provide psychological counseling so that we can help the students to understand the epidemic situation and improve their anti-epidemic capability. And third, we will work with the local communities and the residential areas to making sure that these students are safe. And right now, for 3 universities in Shijiazhuang, for some of them, they are actually taking some of students back to the campus. And fourth, and each day, we have to check the health condition for those students who are staying in Shijiazhuang City to understand their health condition. Fifth, when necessary, we will roll out nucleic acid testing to the students who are staying in Shijiazhuang. Right now, we have completed the testing, and all cases reported negative. For the students who are staying in the campus, we are also doing a lot of work. First, we have improved the administrative support to making sure that the students can shop and also to buy daily necessities inside of the campus, and so that we can making sure that these students' life will not be affected because of the prevention and control regulation. Also, when necessary, we will provide some disinfectants and PPEs to the students. And third, for the campus, we are doing a lockdown management. Fourth, we are strengthening the prevention and control measures in the campus. We are monitoring the health conditions of the students as well as the teachers. At the same time, we are working together with the educational departments. And also, we are asking campuses in other cities to provide more care to students who are originally coming from Shijiazhuang City. Last, I would like to extend my appreciation to the general public, especially for your understanding and support for our work. We hope the students can work together with the local residents and win the battle against COVID-19. Thank you for your questions. And thank you for the press release from the speakers. And that's the end of the press conference. Thank you.